Welcome to Conversations with Dr. Libby. It is such a joy to be here and to bring these conversations to life. I have wanted to do this for such a long time. There are three pillars to my work: biochemistry, nutrition, and emotions, or you could say mindset. So I look at absolutely everything through those three lenses, and through these conversations, we're going to apply those lenses to lots of different topics. But for this first series, it's all about iron. Sometimes these conversations will simply be me having a chat with you, and then other times I'll invite other people who are experts in their fields onto the couch to have what I hope are some really insightful conversations that bring immense benefits to your world. But either way, I hope these conversations deepen your appreciation of your extraordinary earth suit, because after all, we look after what we care about. Welcome to Conversations with Dr. Libby. In this episode, we're going to look at iron deficiency and children. I apologise ahead of time if I get a bit teary-eyed. Having worked with lots of children who have lived with iron deficiency, it's a topic incredibly close to my heart. Iron is so incredibly important for the development of children, and I'm so deeply concerned that in this modern world it is being missed. So I hope that you get a lot out of this episode. And it's something that I care about so deeply. So thank you for joining me for this one. So iron deficiency is the most common nutritional deficiency globally. And there are many, many children who just literally aren't eating enough dietary iron. So around 75% of infants, it's estimated down under, aren't eating enough iron, and 25% of toddlers just not getting enough iron going in on a daily basis. And it makes sense because when I talk to mothers, when I sort of, even see social media posts, there might be a parent who is incredibly attentive and cares very much about their child's nutrition, and they're sharing photos or writing pieces about what they're feeding their child and they're doing an amazing job. I'm not taking away from that. But I regularly see that iron is forgotten in that. And so often there aren't iron-rich foods in even what are nutritious lunchboxes, let alone in lunchboxes that are filled with ultra-processed food. So please know what I'm going to share in this episode is not to put anyone down. It's to, I hope, educate, I hope, inspire, and also offer you some practical tools about ways to offer your child some more iron-rich foods. So as you reflect on the symptoms of iron deficiency in children, let's just take pause for a moment. Parenthood can already be challenging enough. I know there is immense joy, of course, that coexists with some of those challenges. But imagine if the challenges could be less. So when you think about a child who's really struggling to concentrate, or you think about a child that just can't make themselves focus despite being asked to, or they're really struggling to learn even though they're really intelligent, or they can't fall asleep because their body is so agitated, or in their temperament, they just throw to irritation or agitation so easily, and that upsets them. They can see that it upsets you as their parent, or it might upset their sibling. So I guess if we just pause to think about the ripple effect of some of those symptoms on the child and on a family situation and on their social interactions and on their learning, imagine if that is iron deficiency. Because what I just described can be driven by all sorts of different things, but iron deficiency is one of the things that can drive that cluster of symptoms. So imagine if it was iron deficiency and that was then treated, imagine what life would then be like for that child and for you and for the entire family dynamic. I've said it a few times in these episodes, but that literally changes the trajectory of that child's life and potentially your life and what your family looks like in the future. So it's one of the reasons I am obsessed, literally obsessed with iron deficiency, because I see that it can really take its toll, not just on an individual, but on relationships and on family dynamics. So yeah, it's a really worthwhile reason to investigate it for a child. So there are different stages of iron deficiency, and so therefore it will show up very differently in children. So obviously the first stage where there's simply negative iron balance, we usually won't notice that. The next stage is iron depletion, then iron deficiency, and then iron deficiency anemia. And sadly, for too many children, their iron deficiency is not picked up until they're in that last more serious state of iron deficiency anemia. So let's have a look at some of the symptoms and the way iron deficiency can show up in children. They'll usually have a pale face, and when the deficiency is severe, so once they're in that sort of anemia kind of state, their appearance almost has a translucent kind of look to it, and sometimes there'll be a visible blood vessel. It's blue, purple in appearance, and it's often sort of across the bridge of their nose, or it might be on their temple, and you'll notice that sort of you can see it essentially through the skin. For some children, the whites of their eyes almost get a bluish kind of hue to it. So they're some of the things to look out for, but it's pretty severe once it's at that point. They'll usually have a poor appetite, or they'll be a picky eater. They don't want meat when it's offered. So I've had lots of parents say to me, it's as if my child's a vegetarian, even though we as a family aren't vegetarian and meat is offered to the child. They decline the meat. They're just not interested. And some children, very young children, will declare they're vegetarian because they've heard that's a way to describe what happens when you don't eat meat, but it's because they don't want it because they're iron deficient, and they could also be zinc deficient, but we'll get to all of that in a moment. They have a tendency to, in their little nature, it's almost like they're so easily irritated. They're really easily agitated. So keep your eye out for that. And they can find it really difficult to concentrate. Now, that's a can of worms in itself, because it's very easy to attribute the inability to concentrate to modern life and lots of stimulus in our world for very busy and clever little minds. I worry very much that we're very quick with if lousy concentration is observed, we're very quick to go down another road, which I'll unpack that a little bit later in this episode. Other symptoms that a child might be iron deficient, they'll often have a rapid heart rate. They might have a swollen tongue. They often will develop or grow slowly, or they go through a patch where that happens. They have pale gums in their mouth. And if you very gently pull their little eyelid down and look inside, it should be beautifully bright red. And for iron deficient children, it's very pale just inside their eyelids. For children who drink more than half a litre of cow's milk per day, you're at greater risk for iron deficiency and iron deficiency anemia for a number of reasons. The milk can crowd out other foods, so the child lacks an appetite to actually sit down and eat a meal because they're having so much milk, and also calcium and iron compete for absorption. They might show signs of shortness of breath, restless sleep, despite being really tired. They typically will experience frequent infections, and I know this has become incredibly common, but I want to just put a little note here. If you notice that your child starts to experience recurring infections, see it as a red flag. There's something awry. So consider, is it an iron deficiency, a zinc deficiency? It could be both. But don't just accept, it's just how life is these days. You want to think, what could be going on here? Sure, some sickness is normal. In fact, it's healthy. But when it's recurring and there never seems to be an end to it, that you want a little red flag there, what's happening nutritionally for the child. They have a tendency to cold hands and feet. They eat or crave non-food items. Some of them will crave ice, as adults with iron deficiency tend to do. But for little children with iron deficiency, they might experience what's called picker, where they want to eat things like sand or dirt or paint. And it's almost as if they're seeking iron through those other mechanisms, through those other roads, which obviously is not ideal. And for young boys, their puberty is delayed when they're iron deficient. So that's something else to keep in mind. So when I was still seeing patients, I worked with a lot of children, and I just want to share what I will simply call a very common scenario. So it's not a case study as such, but it's a pattern I saw over and over again in young boys. So when they're very young, they get recurrent infections. So usually a streptococcus-based infection, which will show up typically these days as ear infections. It can be tonsillitis, bronchitis, or croup. But usually these days it's recurring ear infections. I've met lots of little boys who have had 20 rounds of antibiotics before they're 2 years old. So their gut microbiome has had a pretty hard time when that's been the start to their life. And again, there's no judgment here. I'm just sharing a very common scenario of a pattern that I see, particularly in little boys. So these recurring infections, they're often almost addicted to cow's milk. So it's not just that they like it or they're happy to drink it. It's give it to me. I have to have it. It's kind of like an addiction, and they're having more than half a litre a day. There's also a major lack of dietary iron intake. So these children are not into iron-rich foods, almost iron-containing foods. They certainly don't want red meat. They might go for a white meat. They might go for, say, chicken. They might go for a chicken sausage because that's even easier to kind of chew up for them. But they certainly don't want red meat. And it's usually about now that a parent would say to me, it's as if my child's a vegetarian. And that immediately a red flag goes up for me that we need to make sure that they're not iron and or zinc deficient. So iron is needed for a child to have a really healthy appetite as well as for their cognitive development. Without enough iron, not only do they become a fussy eater, but their learning and their development can be adversely affected. Zinc is responsible for the taste and the texture of food. So for some children with really narrow eating, as in they only want to eat sort of 3 or 4 foods, it can also be a zinc deficiency. So sometimes it's iron, sometimes it's zinc, and sometimes it's both. But the lack of dietary iron intake keeps the iron deficiency going right at a time where their growing body and their developing brain desperately needs really good iron levels for all of the functions that it's needed inside of us. Now, before I take this further along this child's development, I want you to consider the symptoms that we've already discussed about how iron deficiency can present in children. Symptoms such as poor concentration and inability to focus, that they're easily irritated. All of that makes learning harder. That can also make learning frustrating. And this too can lead a child to being taken down essentially a psychological road. And that might be the right road for them. But I worry very much that iron deficiency gets missed when there's so much symptom overlap between iron deficiency and things like ADHD. Iron is so crucial to cognitive development, and it's being overlooked. It's as if it's been forgotten in favour of other trendier kind of nutrients. And it's the other reason why I called my book Fix Iron First, because we want to do that and then we want to treat anything that's left over, if there is anything left over. So iron deficiency has actually been linked to ADHD symptoms because iron is vital for dopamine synthesis. So obviously dopamine is a neurotransmitter that's been implicated in ADHD. Studies suggest that iron supplementation could benefit children with ADHD, and low iron levels, especially low ferritin, the protein that stores iron inside of us, are associated with cognitive issues, inattention, and hyperactivity in children. And children with ADHD often have lower iron levels. So it's worth investigating. If a child has the symptoms that we currently label as ADHD, you want to test their iron first and address that, and then see if additional support or intervention is needed for the learning, behaviour, and healthy development of that precious little human. Anxiety too is a symptom of iron deficiency at any age. So this is also worth keeping in mind. Imagine if at least some of what's currently being treated with psychiatric medication was actually due to iron deficiency and we treated that. It would potentially change the trajectory of that young child's life. Okay, back to this really common scenario that I saw in so many young boys, some girls, but mostly boys. By now, they're thought of as picky eaters, but it's usually just iron deficiency, zinc deficiency, or both iron and zinc deficiencies. These children tend to only want to eat white or brown food. They'll usually eat fruit though. Some are actually little fruit bats. They're really happy munching on fruit. They'll have at least 3 pieces a day. I remember one having 12 pieces a day. And they were a 4-year-old tiny little human having 12 pieces of fruit a day. It was a lot. So they're often little fruit bats, but they're not a fan of red meat. They won't eat red meat. They usually won't eat vegetables. Usually they'll eat potato, but they're really picky. There's only a few select foods they'll usually eat. And then as they get a little older, they'll usually start to accept chicken. It is white after all, but there's not much iron in chicken. They'll usually eat some ham, but again, there's not much iron in ham. So still they're not getting enough dietary iron going in, and by this stage they might be 8 years old. If they are offered salt and vinegar chips, they usually take to them. So I would hear so often that kind of became a household staple because it was at least something the child would eat. And I always want to know why. My brain goes to why pretty regularly. And when I thought about it, And what I'm about to share is literally my opinion. There is no evidence for what I'm about to say, but I used to think they're seeking the vinegar in the salt and vinegar chips because obviously it's acid. And these children typically have lousy stomach acid production. So they either don't make enough stomach acid or the pH of their stomach acid is too high. Now, that's a whole story to unpack on its own that there's kind of not the space to do in this episode. I have written about it in some of my books. It's in Exhausted to Energize when I talk about the energy of teenage boys. But essentially, all we need to know for this conversation is that there's not enough stomach acid or the pH of it is not acidic enough to do critical digestion work, and it's also affecting their appetite. We also need robust stomach acid production to be able to absorb iron. So it kind of all feeds into itself. The lack of stomach acid, the disrupted gut microbiome, the lack of dietary iron going in because they're iron deficient and therefore their appetite and kind of is reduced and they're picky. So it's a really vicious cycle. But I think the salt and vinegar chips start to feature because it's almost like the child is trying to improve their stomach acid using the vinegar because it's acid to try to do that. Often with these boys, puberty is delayed. So you might notice that their friends are developing pubic hair or their voices are changing. And in an iron deficient boy, often that's delayed. It's a lot slower to come. There's nothing wrong with that. It's just that if the delay in puberty is being caused by iron deficiency, then that's a problem. And there's actually studies that have shown that correcting the iron deficiency can actually help. If a child is iron deficient, will actually help to bring on their puberty. For young girls, their iron-related challenges, they might start in infancy, particularly if they were born premature, which is, we'll have that conversation in another episode. For young girls, their iron-related challenges might start in infancy, absolutely, even more so if they were born premature, but we'll look at that as a topic in another episode. But if they aren't showing signs of iron deficiency when they're children, it's really crucial to watch out for this once menstruation begins. So we want to approach iron with children in a food-first way. However, if you have tried that and the child just won't take to eating more iron-containing foods, then that is when supplementation can be extraordinary and make such a difference. Because once the iron level comes up, then their natural desire for more and a wider variety of foods naturally increases. So whether that's iron, whether that's zinc, or both of those minerals can make such a difference to the child's just innate desire to have a wider variety of foods and to make meal times far less challenging for all of you. And yet too many toddlers, children and teenagers, teenage girls especially, and even more so those who eat in a vegan or vegetarian way, it's really tricky for that group often to meet their iron requirements through food alone. For some, sure, their iron deficiency stems from an issue with absorption, but we can too easily lose track of just how much iron we actually need to eat in a day to meet our requirements. So when it comes to lunchboxes, as I described, I've seen, extraordinary photographs from very caring and attentive parents providing their children with gloriously nutritious food to head off to school or for their lunchboxes during the day. But the lack of iron-containing foods regularly catches my eye. There might be a boiled egg occasionally, but otherwise only tiny amounts in the fruit or the hummus and the vegetables that have been included in there. So again, I've got to say this again, please don't get me wrong. This is exceptional and it's full of nourishment. I'm simply sharing that so often, even if a child's lunchbox is filled with nourishing foods, often iron is just at inadequate levels. So breakfast and dinner need to have a major iron focus for growing bodies. So as a guide for some iron-rich foods, animal sources include red meat, offal, so it might be that you can add some chopped up liver into mince. Sometimes you can actually buy mince these days that's beef mince and then liver is mixed up through that, so that will make it even richer in iron. Sardines, mussels, shellfish and eggs. So they're animal-based sources of iron. Some plant-based sources include seaweed and parsley. Greens, so kale, spinach, especially those two, silver beet, goji berries, tofu, legumes, and nuts and seeds contain a small amount. So obviously we ideally obtain iron from a wide variety of foods, but keep in mind the bioavailability from the animal sources is greater than the plant-based sources. As far as the RDI goes, for little children aged 7 to 12 months, they need 11 milligrams per day For those aged 1 to 3 years, it's 9 milligrams per day. For those aged 4 to 8 years, it's 10 milligrams per day. 9 to 13 years, it's 8 milligrams per day. Teenage boys, 11 milligrams per day. And for teenage girls, it's 15 milligrams per day, which if their periods are heavy, they'll need more than that, more like the adult women's dose, which is 18 milligrams per day. So just keeping in mind those RDI amounts. But when we think about that, and particularly if children are eating in a restrictive way that they're doing to themselves because they just want to eat 4 different foods, or they only want white foods or brown foods, for example, it's no wonder that many require and benefit from supplementation. Remember, though, that there are different types of supplementation. There's a whole separate episode that unpacks that. And the most bioavailable form of supplemental iron comes from organic peas in the form of ferritin iron. So Iconic Iron contains that ferritin iron with all of the cofactor nutrients that we need once iron is actually inside of us. So the iron can go to all of the places it needs to go where we need it to do its critical work. So it might be that from here you're going to focus on more iron-rich food in your child's breakfast and dinner if lunch is too tricky. Or you might decide that a period of supplementation might be key to getting their diet to broaden and for meal times to become less tricky. I encourage you to take action on what has arisen for you. I hope this episode has been useful for you in a really practical way, or that it prompts your thinking. It might prompt you to think, do I need to contemplate having a blood test for my child? Now, obviously, there'll be some children for whom that's fine, depending on their temperament, and for others, you couldn't imagine anything worse. If that's the case, your healthcare professional, whether it's your GP, your pediatrician, or it might be a nutritionist or dietitian you work with, a naturopath you work with, they're educated to know, to be able to determine if someone is iron deficient based on their symptoms as well. So that might be a gentler way for you to go. But whatever it is that's arisen for you, if it is investigation into if your child is indeed iron deficient, I just encourage you to take action on whatever has bubbled to the surface for you, because it is taking new actions that enhances the quality of our lives and the lives of our children. Thank you so much for joining me, and I hope to see you soon.